Doctors are human beings. We forget that sometimes. And sometimes, so do they. A visit with your doctor should be a dialogue and not a one-way conversation. Doctor-patient communication is a critical aspect of healthcare delivery, impacting patient satisfaction, treatment adherence, health outcomes, and even the efficiency of healthcare systems. Medical care is a service, and as the customer of that service, you have the right to make your voice heard if you have a question, a concern, or a complaint. Why are patients reluctant to ask questions of their doctors? There are a lot of reasons. First of all, some patients perceive doctors as authority figures and feel intimidated or uncomfortable asking questions. In some cultures, questioning authority figures like doctors may be perceived as disrespectful or taboo. Second, patients may fear being judged by their doctors for asking stupid questions or expressing uncertainty about their health. There are no stupid questions. The more you know about your body, the better can you take care of yourself. 3, patients may struggle to understand medical terminology or complex explanations provided by their doctors. No surprise there. Get them to talk to you in plain, simple language. 4, patients may avoid asking questions because they just don't want to hear possible bad news about their health condition. But not knowing isn't going to cure it. A 5th reason could be that negative past experiences with healthcare providers where they felt ignored or not listened to has diminished their trust and confidence in seeking clarification or asking questions in future interactions with medical personnel. And finally, language barriers, hearing impairments, or cognitive impairments can all impede effective communication between patients and doctors, making it difficult for patients to articulate their questions or concerns or understand the physician's prognosis or instructions. This is when it can be helpful to take along a companion, a spouse, a friend, or a family member, not to speak for you, but to help you speak for yourself. What are the consequences of doctors and other medical personnel who fail to effectively communicate with patients? At the very least, it causes patient anxiety and confusion. You leave the doctor's office worse off than when you arrived. At worst, it can lead to misunderstanding of vital information about your diagnosis or treatment plan. The 3 main goals for effective doctor-patient communication should be creating a good interpersonal relationship, facilitating exchange of information, and including the patient in the decision-making process. Doctors are in a unique position of respect and power. Doctor-patient communication can be a source of motivation, incentive, reassurance, and support, or fear, intimidation, and discouragement. A good doctor-patient relationship can reinforce patients' self-confidence, motivation, and positive view of their health status, which will influence their health outcome. Most complaints about doctors are related to issues of communication, not clinical competency. Patients want doctors who can skillfully diagnose and treat their illnesses, as well as communicate with them effectively. Doctors with good communication and interpersonal skills are better able to detect problems earlier, may possibly prevent medical crises and expensive interactions or interventions, and provide better support to their patients. This can lead to higher quality outcomes and better satisfaction, lower costs for care, greater patient understanding of their health issues, and better adherence to the treatment process. There needs to be a greater effort toward collaborative decision making, with physicians and patients participating as partners to achieve the agreed upon goals and the attainment of quality of life. The patient will never care how much you know until they know how much you care. I'm Larry Johnson. Until next month, stay well.